How to get rid of tension headaches. Hello and welcome to Health and Remedies, a channel which covers health conditions and their treatments, complementary medicine, nutrition, beauty, trending health topics and emerging health issues. Do you suffer with headaches and cannot get rid of them? Or have you ever wondered what type of headache you have? This video will cover tension headaches and how to get rid of them. Also, if you enjoy this content, please like and subscribe to the channel. Now let's get into it. A tension headache is experienced as mostly a diffuse, mild, moderate or intense pain behind the eyes and in the head and neck. Tension headaches typically develop within the afternoon, inflicting mild or moderate pain that causes dull pain, tightness or pressure around the forehead or the rear of your head and neck. Tension headache is the most typical kind of headache. However, its causes are not well understood. They're known as stress headaches and are very common in adults. Tension headaches occur when the neck, shoulder and scalp muscles become tense. This can place a dampener on your day. Tension headaches have various symptoms which include tightness across your forehead or on the edges and back of your head, aching head pain and tenderness on your scalp, neck and shoulder muscles. Most headaches are tension headaches, and these headaches tend to happen particularly if you're under stress. Tension headaches will last from half an hour to 7 days. If you have got a headache for 15 days or more per month over 3 months, then this is a chronic tension headache. Plus, if you have got frequent episodic tension headaches, you could even have migraines. Tension headaches typically are not related to visual disturbances, nausea, or instinctive reflex. Frequent episodic tension headaches occur, but 15 days a month for a minimum of 3 months. Frequent episodic tension headaches might become chronic, whereas chronic tension headaches last for hours. Chronic tension headaches occur between 15 or more days a month for a minimum of 3 months. If you have got frequent tension headaches, usually more than once or twice a week, here are ways to get rid of tension headaches without a trip to the doctor. Place a cold pack on your head. If you have a tension headache, place an ice pack on your forehead, which can include ice cubes wrapped in a towel, frozen vegetables, or even a longer cold shower that may ease the pain. Keep the cold pack on your head for 15 minutes and then take a break for 10 minutes. This will help ease the tension headaches. Use a heating pad or take a warm shower. Heat stimulates nerve endings referred to as thermoreceptors, which can block the pain signals from that space to the brain. Blood flow is increased to the area and relaxes muscles by heat therapy. The increased blood flow is believed to assist with pain because it increases proteins, oxygen, and different nutrients to the area in pain. Tense muscles will trigger tension-type headaches. Apply heat or ice to relieve tense neck and shoulder muscles. You can use the following to apply heat to the pains: a hot pad set on low, a hot shower or bath, hot water bottle, a warm compress, or a hot towel. When having a tension headache, placing a heating pad on the neck or back of your head will help get rid of the pains. Holding a warm cloth to the area that hurts also does the trick. A warm shower has been proven to ease the pains. Ease pressure on your scalp or head. Ease pressure on your head when having a tension headache. Wearing a tight hat, headband, or even swimming goggles is not advisable for someone having a tension headache. Dim the lights. Bright or flickering lights, even from a phone and computer screen, can cause tension headaches. Use blackout curtains during the day if you're used to them. Wear sunglasses when outdoors. You can also use daylight spectrum fluorescent bulbs in your light fixtures and add anti-glare screens to your computer. Try not to chew. When having a tension headache, try not to chew your gum because it can hurt not only your jaw but also your head. Avoid chewing anything like your fingernails, handy objects like pens, lips, or the inside of your cheeks. Avoid crunchy and sticky foods or food high in fiber, and make sure you take small bites, once at a time. If you are the type of person that grinds your teeth at night, consult with your dentist about a mouthguard, as this may curb the tension headache. Hydrate. A recent study shows that plenty of liquids when having a tension headache helps to relieve and get rid of it. Dehydration can cause a tension headache or make it worse. Get some caffeine. When having a tension headache, take some coffee, tea, or any drink that has a little caffeine in it. Drinking it early enough after the pains start could ease your tension headache. It can also help relievers like acetaminophen work much better. However, do not consume too much caffeine because caffeine withdrawal can worsen the tension headache. Practice relaxation. Whether it's yoga, stretches, meditation, or progressive muscle relaxation, learning how to relax in the middle of a tension headache can help with the pain. Talk to your doctor or therapist about physical therapy if you have muscle spasms in your neck. Physical and psychological relaxation therapies can help get rid of tension headaches as long as you practice these techniques regularly. Imagery exercises that are guided will help you focus more attention on various parts of your body, relaxing them and releasing tension and stress. Try massage. Massage is good when having a tension headache, and you can do it yourself. For a start, take a few minutes to massage your forehead and neck. Massage helps ease tension headache pains, which may arise from stress. You can learn to recognize when you're becoming tense or stressed, and practice ways to relax your muscles before they tighten so much that you cannot relax them and develop a tension headache. Rotating pressure to the painful area helps to get rid of the pains. Exercising muscles also helps by stretching and strengthening them. Medical approaches. It shows in a recent study that people with tension headaches have sensitive areas known as trigger points. It can be at the back of the neck for some, or in their shoulders. Injecting a local anesthetic into these sensitive areas may eliminate the pain and stop the tension headache from occurring again. Some medications can be administered to keep tension headaches away. If non-drug therapies are not working for you, then you should talk to your doctor about the right medication options that might be good for you. In conclusion, try employing a headache diary. Whenever you get a headache, write down the date, the time, and what you were doing and feeling before your headache started. This might assist you and your doctor to resolve what's inflicting your headaches. Then your doctor will use the diary to arrange your treatment. In addition to regular exercise, techniques like training program coaching and relaxation medical aid will facilitate with cutting back on stress. Using medications in conjunction with stress management techniques could also be simpler than using either treatment alone in reducing your tension headaches. Pay attention to the basics. Get enough rest, eat when you are hungry, and be sure to avoid stress and fatigue at all times. Reduce all forms of stress, get enough sleep, and make enough time for relaxing, such as reading, taking a hot bath, or stretching and improving your posture to avoid tensing your muscles. Thank you so much for watching this video. If you enjoy this type of content, don't forget to hit the like button, subscribe to the channel, and hit the notification bell for more informative videos. Also, feel free to leave a comment. Have you suffered with tension headaches? Have you tried any of the above mentioned techniques? Share in the comments what has worked for you. I look forward to sharing another video with you soon. Bye for now.